This is the module for MR safety as we continue to build your MR foundation. This course is intended to cover the important safety considerations for patients, staff, and MR professionals in an MR setting. By the end of this course, you should be able to describe the safety concerns related to the static magnetic field, gradient field, and radio frequency. Identify the limitations of the MR safety advice. Identify the safety buttons involved in the MR system and the situations where a clinician would need to use them. MR safety. Why is it important? There is no ionizing radiation in MR, unlike CT, where there is a low dose. In MR, it is no dose. But there are three main MR safety concerns when it comes to MR imaging. The static field, also known as B0, the gradient or time-varying field, and the radio frequency or RF field, which is also known as B1. All of these will be covered in detail in this training. Let's first start with static field. The most important rule in any MR scanner is to always assume that the magnet is on. The MR scanner does not shut off. Never take a chance that the magnet is off when you walk into an MR scan room or a manufacturing facility. Always assume that the magnet is on. Now that we've determined the fact that the magnet is always on, let's understand the means and how powerful a medical imaging MRI scanner is. The red lines on the bar magnet graphic represent the Gauss lines of the magnetic field. The closer that they are to each other, the stronger the attraction. Notice where the lines are more compact, at the end of the magnet. This could easily represent the opening or the bore of an MR scanner. And this is why the strength of the magnetic field increases exponentially as you get closer. Take a minute to review this recording. The setup here is a barrier that was placed in front of the bore of the scanner with different objects placed on it. Next, a simple pipe wrench is released, not thrown, but simply released, and allowed to have the magnet pull it towards the center. Now, pay special attention to the second object that is placed in front of the barrier. If an MRI can do that, imagine what it can do if a person was in its path.
The missile effect refers to the capability of the fringe field of the static magnetic field of an MR system to attract a ferromagnetic object and draw it rapidly into the scanner with considerable force.
That was a fairly short recording, but it was an impactful one. Imagine if it was a person instead of those bricks in front of the magnet. Now, the chances of a pipe wrench being brought into the scan room are not necessarily as high as, let's say, like a pair of medical scissors or even an oxygen tank. This is why you should assume that the magnet is always on. The potential for a serious accident to occur is incredibly high if you don't have a healthy respect and understanding of what could happen in an MRI scan room. A magnet always being on is referred to as a static magnetic field. One must always respect the magnetic field. The concern isn't always oxygen tanks, although the bigger the object, the more momentum it can gather as it becomes ballistic. The main things that one should worry about are the most common items found in pockets or loose objects that will be attracted to the magnetic field. Examples of loose objects could include keys or pocket knives, coins that have ferrous properties. Let us consider a wallet with credit cards here. Will these be attracted to the magnetic field? Not exactly. These don't become ballistic projectiles, but given that a scanning magnet is stronger than the magnetic strip on the back of the credit cards, it'll erase the credit cards or hotel keys or anything similar in that nature. Therefore, it's always important to remove any loose objects from your pockets, such as watches or anything that could be attracted to the magnet, and leave them outside the MR scan room. So we established that there are projectile, ballistic, or torquing hazards associated with the static magnetic field. But are there any biological effects? At this time, there is no conclusive evidence for irreversible or hazardous bioeffects related to acute, short-term exposure to static magnetic fields up to field strengths of 2 Tesla. During the time of this study, 2 Tesla was the highest field strength approved for clinical MR imaging. Today, the clinical maximum field strength is 3 Tesla, and it's still not considered to have any biological effects from the static magnetic field. Accidents happen far too frequently. Why? Poor training, lack of respect, or any other reasons. Floor buffers, hospital beds, tools, wheelchairs, all of these have the potential to be deadly missiles. The common mistake is even though technologists have been trained, they don't understand the power of the magnet or the physics of getting too close. I can hold on very tight and it'll be okay. Or, I didn't know the magnet was on, are frequently famous last words as the magnet sucks the item right out of their grasp. Here's an example of how a mistake can lead to an MRI accident. The results can be deadly. In 2001, a 6-year-old boy was killed in an MR scanner as he underwent an imaging procedure. This happened because someone took an oxygen tank into the scan area, not realizing that the one they held was not MR safe. The tank, attracted to the magnet, became ballistic and flew towards the center of the magnet, which happened to be where we scan, striking the child's head. Never take this lightly. Always respect the magnet and always assume that the magnet is active. One of the properties of the static magnetic field is to influence other ferrous objects. And in some cases, the actual shape of the object can make it more sensitive to this influence. In this case, we are looking at aneurysm clips that can have some attraction to the magnetic field. Aneurysm clips are surgically implanted to hold back an aneurysm from fully rupturing, and their shape is elongated. And it is this shape that causes the clip to attempt to align to the magnetic field once it enters it. The problem is that the brain tissue does not form scar tissue like the rest of the body. If you were to have a clip implanted in the gallbladder or some other tissue, it would have to be investigated for safety with the manufacturer, but most likely it will have developed enough scar tissue to render it relatively immobile. Ultimately, it will always fall into the imaging sites to decide the safety of the scanning. But aneurysm clips pose a greater threat due to the brain's inability to form the same kind of scar tissue as the rest of the body and its shape. As the patient progresses into the magnet, the clip will try to align with the field, and in thus doing so, puts the very aneurysm that it was trying to protect at risk for rupturing open. There are some MR-compatible aneurysm clips, but make sure you check with the manufacturer to see if those are compatible. Much like the aneurysm clip, foreign bodies in the orbits pose a risk to the patient's vision. If it is in a specific shape, or if it is significantly attracted to the magnetic pole of the static field, it has potential to move. And in doing so, could damage the retina, or possibly to the extent of permanent visual damage to the patient. This is why many sites do plain radiographs or CT scouts of the orbit for those patients that had a positive response on their pre-MR questionnaire to determine if there's any remnant of that metallic foreign body left in the eye. Another aspect of the static field is the fringe field, and this refers to the amount of magnetization that occurs outside the magnet itself. It is always important to know where the 5 Gauss line is. The 5 Gauss is the determinant of which is considered safe for many implants, equipment, and general public. Don't forget that magnetism can pass through walls. This means that the 5 Gauss line may actually be on the other side of the scan room wall. Knowing what is on the other side is an important sighting factor with regards to safety. Another aspect of MRI safety has to do with the gradient magnetic fields. The gradients change in intensity over a distance, and they do this rapidly over and over. This is how spatial orientation is obtained. But these rapidly changing gradients can induce a current in a conductor. This is referred to as Faraday's law of induction, where, in the simplest explanation, a loop of wire is placed by a changing magnetic field and an electrical current is produced. So why does Faraday's law of induction matter in MRI? Consider all of the possibilities of looping in the body. This could be a wire, it could be the looping of the cables, it could even be the looping of extremities by simply folding your hands across your abdomen, thus making a loop of human tissue. No matter how or what it's made of, a conducting loop that is exposed to a varying magnetic fields has a potential to induce a current. Consider a stimulator implant. This is an electronic device that has leads going into an area to be stimulated and a returning lead coming back to the device, thus creating a loop. These kinds of implants were developed to deliver a very precise current, and the varying fields of the gradients could significantly alter that by inducing its own current. Therefore, the scanning of a stimulating implant is considered to be contraindicated by MR. These illustrations here are just a few examples of a stimulation device. A pacemaker stimulates the heart to beat in regular rhythm. A cochlear implant that can stimulate the brain for hearing. And there are many kinds of stimulators that have implanted drivers and leads that go to organs or tissue to be stimulated. These are X-rays demonstrating a bone growth stimulator. If you look closely, you can actually see the wires going to the tissue and back, thus creating a loop. For the most part, the presence of a cardiac pacemaker should be considered a contraindication for MR imaging. However, recent developments in the pacemaker technology have made MR-compatible pacemakers a reality. Never assume that somebody's pacemaker is compatible. Make sure to check for the patient's ID card at the time of their implant. PNS, or peripheral nerve stimulation, is also the result of a changing gradients. But what is it? Well, these rapidly changing gradients can sometimes have the effect of causing the nerves just below the skin to become stimulated. The point where 50% of the population would experience PNS is referred to as the PNS threshold. What does it feel like? It can feel like light touching sensations or a twitching sensation on the skin. The potential for PNS occurring is very low, but it is still possible, and there are contributing factors that can lead to this. And what contributes to this phenomena? It could happen with any sequence, but we primarily see it with EPI-based sequences, where the gradients are switching very rapidly. A few examples of EPI sequences are rapid brain imaging, DWI, fMRI, also known as bold imaging, diffusion tensor, time course imaging, and any number of abdominal or gradient sequences. All of these are examples of steep gradients that are switching on and off very fast. While the sensation of PNS can feel odd, it is important to understand that PNS itself is not harmful. The final aspect of safety with regards to the gradients is acoustic noise. The acoustic noise associated with MR scanners comes primarily from the gradients, and it increases with the gradient strength. It is also louder with faster imaging sequences. But there are new scanning techniques to help reduce that acoustic noise. Some reduce it to the point of near ambient room noise. Some MR scans have acoustic sound levels that exceed 99 decibels and have the potential to lead to hearing injury or impairment. The IEC requires that noise levels be reduced to at least 99 decibels to prevent such injuries. Even with the advent of new scanning techniques, it is important to note that our safety guidelines have not changed, so hearing protection is still a part of the recommended procedures. This recommendation is extended beyond the patients to the visitors, technical, and ancillary staff when the scanner is scanning, regardless of the static field strength. This is applicable when the scanner is actually scanning and the gradients are switching. When not, the ambient room and the scan room noise does not exceed the level where hearing protection is required. As stated earlier, the static magnetic field is referred to as the B0 field. The radio frequency field is referred to as the B1 field. In this next section, we'll look at the safety concerns with regards to the aspect of MR scanning. The radio frequency field, or B1, is responsible for heating of tissues. The amount of RF disposition depends on many factors. The biggest factor is the field strength, but it can also be related to the flip angle, which refers to how far the protons are flipped from the longitudinal plane, and even the pulse sequence itself, which is the sequence of parameter manipulations that are used to create the image. The RF disposition into a tissue can be measured and is referred to as SAR, or specific absorption rate. In MR Physics Basics, we talked about the R in MRI, and it stood for resonance, which is the transfer of energy. This energy transfer is in the form of radio waves, and this transfer will result in heat. The greater the amount of RF used, the greater amount of tissue heating. Now let's consider the RF energy based upon the field strength. The higher the field strength, the stronger the pull is to keep the hydrogen protons aligned with the main field. Thus, more RF is needed to knock them down to the transverse plane. However, this is not a linear increase in the amount of energy needed to flip the protons. It is actually logarithmic. So if we look at the amount of energy needed to flip the hydrogen protons in a 1.5 Tesla scanner, it would take 4 times that amount of RF energy to tip the protons at a 3 Tesla scanner, thus increasing the amount of SAR by a factor of 4, even though the field strength is only doubled. If we have determined that we can induce more SAR at higher field strength, it now becomes very important to understand how that SAR is managed. With the release of 3 Tesla Discovery MR750 in 2008, we introduced a new method to manage SAR, and it was called Perform 2.0. As stated in the previous module, SAR is measured in watts per kilogram. Prior to Perform 2.0, SAR was measured by calculating the patient's weight and the type of coil being used. Chances were that we were scanning a knee. Therefore, the SAR threshold was calculated on those assumptions. With Perform 2.0, the scanner measures the reflected RF from the anatomy to accurately calculate the SAR. As stated earlier, SAR is a matter of physics, and it is not vendor-specific. How you manage it becomes the determining factor. Perform 2.0 provides SAR management so the exam does not slow down by breaks to allow the tissue to cool down. The limitation of SAR and the RF deposited in the patient is a user-controlled variable. This variable also controls the gradient output as well. There are 3 levels. The first level is normal. This lower limit sets the parameter thresholds such that all patients, regardless of health status, can tolerate. This does, however, change the RF power and can add scan time, and sometimes can affect the gradient performance, resulting in longer timing parameters and fewer slices per acquisition. The next level is first level, and in most cases, it allows for the shortest TE and TR values, resulting in the optimal image quality and the number of slices per acquisition. However, the first level is not considered optimal for patients with impaired thermoregulatory or cardiovascular systems. Another point to note is that in first mode, about 50% of the patients may experience PNS, while stimulations in normal mode should be rare. Second level can be accessed through a research key only, and it is password protected. It will only appear as an option if the system is scanning in research mode. Because of the operations occurring during the acquisition, it is not unusual for a patient to feel warm during a scan. However, keeping the MR scan room cool during the scans is important. Oftentimes, patients may begin an exam feeling chilled because of the cool room temperature, only to warm up once the scan is underway. In an effort to comfort patients, well-meaning technologists may offer a blanket, sometimes even a warm blanket. However, this blanket, and especially warm blankets, hinder the body's natural ability to dissipate the heat that will occur during the MR scan. Because of this, it is important to evaluate a patient's ability to dissipate heat before offering what at first could seem like a comfort. All customers receive with their scanner a set of RF pads to be used together. It is always important to isolate the patient from touching the side of the bore or coils, as well as direct skin-to-skin contact, because this can make a loop. But by not isolating the skin from these contact points, you create the opportunity of what is known as localized SAR, or more commonly, an RF burn. Using these pads is an important aspect of patient protection, and this should be an important habit for all MR technologists. This is an example of an RF burn. It is important that everyone realizes that an RF injury can happen very quickly. The technologist should not rely on the patient to warn them of excessive heating or discomfort. They may have even been sedated or undergo general anesthesia and not even know it. Failure to adhere to the proper MR safety guidelines can result in RF burns. In fact, the majority of all RF burns are related to improper or non-usage of RF padding. So let's take a minute to think about some things that can heat up during an MR scan. Think about those snaps on a hospital gown provided to the patient. These are small rings or loops that can heat up, and here you can see an example. It actually melted the cover of the pad. For MR, the snaps should be plastic, but many times you'll hear MR technologists state, well, it isn't in the field of view, so the patient doesn't have to change into a gown with plastic snaps. What they're neglecting to realize is that it's more about safety than image quality. In this case, the pad keeps the patient safe from touching the side of the bore of the magnet, but not from the snap that wasn't removed. Now let's look at some aspects of patient protection. Although there is no ionizing radiation associated with MRI, there are 3 specific topics that relate to the safety of the patient as well as the safety of the staff that works around the imaging equipment. For all those who enter the MR scan room, screening for contraindications is a must. Full disclosure of medical history is imperative to prevent many kinds of injuries. Many sites create their own screening forms, and examples of these can be found online. An important aspect of diagnostic imaging that in the U.S., they're starting to see new administrative positions being developed to address the specific challenges with safe MR practices. In fact, a new board certification program was developed just for this purpose, with training programs and certification exams to ensure that the patient's and staff's safety when dealing with MR imaging. Let's look at different aspects of responding to emergencies in the MR suite. In the first module, we talked about the high-field MRI scanners as superconductive magnets that are supercooled by cryogens. Today's technologies utilize a single cryogen called helium. However, there may be some older systems out there that use a dual cryogen of liquid nitrogen in addition to liquid helium, although these should be fairly rare. The thing to remember is that cryogens are extremely cold to the extent of negative 452 degrees Fahrenheit or negative 260 degrees Celsius. And in normal operating conditions, this poses no real safety issues. That cool the magnet, there is one safety term that you should be very familiar with, and that is quench. A quench is an unexpected release of cryogens and the ultimate loss of the magnetic field. As stated before, under normal operating conditions, even in the event of a quench, the cryogens pose no real threat to safety. However, as the liquid helium turns to gas, it needs to go somewhere as it expands. There is still no threat to safety, as there is supposed to be a vent stack that will release the gaseous helium out into the atmosphere. However, if there is some reason that the vent stack fails, there could pose a risk for the patient and the personnel. The point that is important to make here is that the customer is responsible for the vent stack. For example, let's say that there was construction done to the building and the stack was rerouted, adding several turns and bends to the path. The helium from the quench expands very rapidly and needs to have a clear path to the outside. So the ownership of the vent stack goes to the customer. Now, in the unlikely event of a quench and the vent fails, a procedure needs to be in place to evacuate the patient and all personnel from the magnet room. Failure to follow these precautions can result in serious injury, such as asphyxiation as the cryogens displace oxygen within the room, frostbite from extreme cold and gaseous helium, or injuries due to panic. Here are a number of other safety items that you should be aware of. The MRU, or the Magnetic Rundown Unit, is located inside the scan room. The red button is covered by a clear plastic protector to prevent accidental activation. This cover is simply lifted to activate the MRU. It is only used in cases of extreme emergencies where a patient is pinned against the magnet. It is not necessary to activate the MRU if a piece of equipment is stuck inside the magnet, as long as there's no imminent danger to the human life. The field engineer has methods of ramping down the magnetic field without loss of cryogens. This is for both economical reasons as well as safety. So what happens when you press that red button? There is a rapid reduction of the magnetic field. In about 2 minutes, the entire field will have collapsed. This happens by heating the cryogens to the point of boil-off, and this is accompanied by a loud hissing sound. Helium, being short in supply, is not cheap, and the downtime associated with re-ramping the system can be a few days, all of which are inconsequential if human life or injury is at stake. How do you avoid having to use the MRU? Go back to the first rule of MR safety. Remember that the magnet is always on. The previous slide demonstrated how to run down the magnetic field in case of a static field emergency. Now, the emergency off button is located in the equipment room, the scanner room, or sometimes both. This is used to turn off the electrical power to the system components, but keep the magnet at the field strength. This would be used in cases of fire, sparks, or loud noises that aren't associated with the normal operation of the system. It would be the customer that actually activates these safety measures. Lastly, there's an emergency stop button. This is located on the keyboard that the technologist uses and on the face of the scanner near the table controls. This disables the RF, gradient power supply, the table, and the patient support. It is the easiest to recover from as it's a simple button to reset. This also does not affect the magnetic field. Where do you get more information on MR safety? Every customer gets an updated copy of the MR Safety Guide Operator's Manual that's located within the Systems Operator Manual. This is located on each scanner. As we conclude this training, you will now appreciate what's all the fuss about when it comes to MR safety. While there is no ionizing radiation, there is significant safety concerns when it comes to MR imaging with regards to the static magnetic field, the gradient field, and the RF field. Thank you for your attention to this module. This course has covered the following topics: being able to describe the safety concerns related to the static magnetic field, gradient field, and radio frequencies, identifying the limitations of MR safety advice, and identifying the safety buttons involved in MR systems and the situations where a clinician would want to use them.